My name is Ahmadi. I'm a urologic oncologist and an assistant professor of urology in the Department of Urology at the University of Minnesota. To me, training residents is the main pillar of academic medicine and academic urology. We try to share our knowledge with our residents either through didactic sessions or weekly or monthly lectures, and we try to be very approachable and try to come up and create and stimulate their creative thinking by bringing up different clinical scenarios and try to address different management options for those. And by doing those, it's not a very gratifying experience for us to see them, so these really talented individuals to grow and become skilled, well-rounded urologists, but also we feel challenged at times because we get great questions from residents and we need to find better answers for them. And I think eventually we all grow and get better as a department. I think we do have a very collegial and friendly culture in our department. And again, we try to be close to our residents and we think of them as our colleagues and our friends. And also we try to be available to our nursing staff at all times. My first experience with urology was as a second-year medical student, and I did some research projects. And the more I worked with my mentors and the more I became familiar with the science behind it, the more confident I became in my career choice. And as a urologist, you have a wide variety of subspecialties available to you. It could be as simple as doing office-based procedures such as cystoscopy or vasectomies, or it could be as complex as removing a very large tumor from abdomen or pelvis or performing a transgender surgery. I think as a university as a whole and our department, we have a great mix of experience and young, talented faculty members, which all extremely well trained. We also have the luxury of having access to really cutting edge technology through different companies that are based in Twin Cities. And University of Minnesota as a whole, and us, especially urology department, we have a very diverse program, and we strongly promote diversity, which is in line with the philosophy of the leadership at the University of Minnesota. We do have a very active presence as a university as a whole in our department in national and international scientific meetings, and some of our faculty members hold leadership positions in different medical and urologic societies. There are a lot of great things about Twin Cities. What I found really interesting is there's so many bike trails and paths, and you can pretty much bike everywhere that you want to go. And also, no matter how cold it gets, people are not shy about just getting outside, being active, even when it's minus 10 degrees outside. So I love that about this. I think everybody here, all the faculty members are extremely well trained. They got their training from all the top institutions in the country, and we have all the true subspecialties available to them. And again, we have access to the latest technology. So we do have the research infrastructure and the clinical knowledge to offer them the best treatment. So by training, I'm specializing in management of all different types of tumors in genitourinary tract system. But my main focus is on management of bladder and testicular cancers. I find it really fascinating. The surgery is really fascinating. The anatomy is amazing. And there are so many different ways of doing these surgeries. And there are a wide range of disease from a very superficial disease that you can just treat it by placing some medicine inside the bladder to just removing a very, very large tumor. And so you have all the skills available to you, and you can offer them to the patient, or if they don't need it, you can just do it a very conservative management. My main research interest is in bladder and testicular cancer. I work closely with other experts in the country, and we work on some very exciting clinical trials. I've published scientific articles and written book chapters on these topics as well. And I find it really interesting because there are so many untapped areas in bladder and testicular cancer management that we could use genomic data to target specific genes and offer our patients better care and more effective treatments.